Okay, now we have a lot of responsibility to protect our students within the school district. I want you to know that about 80 to 90% of persons who died by suicide express their intentions to someone, and often more than one person. All suicidal statements must be taken seriously. Every time you see or observe a student that makes a statement, you must report it. Every student, every time. School districts have been involved in lawsuits and found liable for several reasons. For example, failing to take proper action, including bullying issues, not offering mental health information and support, providing inadequate supervision of at-risk students, and also failing to notify parents when their child was suicidal. Prevention is everyone's responsibility. Prevention, again, it's important for staff to have professional development and training related to the risks of suicide. What are the warning signs? As well as having policy and procedures in place for what to do if a student has suicidal ideation or threat. It's important to be aware of what students are saying, any kind of planning or what they may be doing. Statements such as, I feel that I have problems that are inescapable. Perhaps they can't eat, sleep, or do their work. Maybe they can't get out of that continued state of sadness. They can't see the possibility of change. Or statements that show they can't see themselves as worthy. Another responsibility is that we must report all safety concerns. As school personnel, we have a responsibility and duty to warn. If a student makes a suicidal comment or is self-abusive, there is no confidentiality to maintain. Therefore, it is strongly encouraged that the student be made aware of this and to encourage the student to report it together. The more student is aware, the more progress that can be made. At times, the students may be angry, but safety is number one. Also, the school has a responsibility to have some sort of referral process. When a student is identified by a staff person as having a possible suicidal threat or comment, perhaps a direct statement saying, I want to kill myself, or anything like that, the student will be seen by one of the following, whether it be a school counselor, school social worker, or school psychologist. Those three are what we refer to as a mental health professional. They have the skills and qualifications to assess the situation. It is important to refer the student to one of those professionals within the same day to assess the risk and facilitate a referral if necessary. If there is no mental health professional available, then they can either be referred to the school nurse or a school administrator to fill that role until mental health professional is available to come. I want to stress the importance of the mental health professional. It doesn't matter if they can sign or not. If they are unable to sign, then bring in a certified interpreter. And the reason why I emphasize the importance of that is because if it were a teacher or a teacher's aide or other staff that doesn't have any training in mental health, they are not qualified to do any type of screening, regardless of their sign language skills. It is important that they're referred to a mental health professional. If that professional cannot sign, then bring in a certified interpreter to work alongside them. You don't want to put yourself in a position where you can be sued. Regardless, the school staff will continue to supervise the student to ensure their safety. Never leave the child alone. Parents must be contacted, regardless of the risk level, and if necessary, help the family in facilitating an urgent referral. we have a responsibility to have an appropriate screening and assessment process. When you have an assessment process, there should be some kind of level of risk. For example, low, moderate, and high. Many schools have different types of screening processes, but I will explain about what our process looks like at Texas School for the Deaf, so you can have a better idea of what levels we're talking about. So, at Texas School for the Deaf, when a student makes a threat, they are then referred to what we call our health center. And the counselor on duty will go to conduct the screening of the student. We have a screening process where the students are asked specific questions, and we also look at what's called the incident reports, behavior reports, and other information that can help assist that process. The assessment, if a student responds yes to 2 or more of the questions, I believe there's about 12 questions in total. So if a student responds yes to 2 or more of the questions, then the student is bumped up from a level 1 risk to a level 2 risk, meaning moderate. A level 1 risk means it's low, and then medium is a level 2 risk or moderate, where the counselor begins to ask for some additional information to figure out if there is a grave concern or perhaps the student needs specific supports put in place. But if, for example, a student maybe has quite a few yeses, they have a plan, they have a method, and they really feel hopeless, perhaps they're not cooperative with the process, that's where the student is then elevated to a level 3 or high risk. If a student is identified as high risk, we begin the process of calling in 911 or the mental health deputies. We may also call the parents to come to take their child to the hospital, whatever services that may be needed. Ensure that you have an understanding of what services are available in your area, whether it be a mental health hospital, some kind of psychiatric emergency center. Regardless, you need to know about your area and local services, especially what the mental health deputies do in their area and how they work. If you do call 911 or the mental health deputies, it is important to have teamwork because it is a lot of work involved. You need to have someone monitoring the students at all times, someone available to interact with the mental health deputies, someone else to gather all the information, someone to contact the parents. There's a lot of work whenever you have mental health deputies coming. So again, that level 3, that high risk, can result in a referral to an agency and allow the parents to take on the responsibility for bringing the child to the entity. It depends on your district and what you have available in your area. But that gives you a general overview of what Texas School for the Deaf looks like and what their process includes. It's also important that we are responsible for our documentation, and it should include quite a bit of information. Some type of incident report, including what was the statement made, who saw or witnessed, who informed that something was said, anything that may have triggered the student, what was happening prior to the comment being made. So perhaps the student received a consequence due to an action and they reported to another student, I feel like killing myself. And so going back to that incident, the antecedent, and putting that down in the important information. It may be a low-risk situation in which the student made a comment out of frustration, but regardless, they must be referred for an assessment. I also strongly encourage you to have some type of behavioral checklist to be able to give to the counselor or mental health professional with a brief general summary of who they are. Perhaps the student typically has good hygiene, but today hasn't. Perhaps they usually have good interaction with their peers, but more recently have been withdrawn. So having a behavioral checklist and being able to clue in that mental health professional with that process. Also, having a list of screening questions and document the student's responses to those questions. There should also be clinical documentation by the mental health professional and the outcome of the process. It is so important to have that documentation to not only protect the staff, but to also protect the student. Having that in place is critical. That being said, I want to be sure to remind you that you do have access to some different sample forms available on the website. That is there at the Texas School for the Deaf website, as well as a few additional forms that you can take a look at and get an idea of what might be best for your school district. We have a responsibility to provide support. Part of that is being aware of the mental health services available in your area, so you can make appropriate referrals for that student and their family. So providing support to a student, perhaps checking in with that student, being present when that student needs to talk. Ensure that the student has built some sort of protective factors to be able to cope better with difficult situations. For example, if the student does not have coping skills or any kind of skills related to problem solving, direct instruction about how to incorporate those skills to better themselves, to be able to take care of situations when they come up in the future. That's an example of a protective factor. Another responsibility we have is post-screening and assessment. We still have a responsibility to monitor the student, meaning that we need to take preventative steps after that student has made a suicidal threat. That can be including supervising where they go, making sure they're safe, checking in, being accountable. Where are they? The student should remain in staff sightlines at all times. Typically, this post-screening time period is 48 hours of increased supervision. Do not send that student alone anywhere. Monitor them in the cafeteria, and all concerns that should come up need to be reported immediately, whether it be to a school counselor or principal. Your responsibility as the staff include ongoing monitoring of warning signs of suicidal thoughts. We need to ensure that the students are where they're supposed to be, offer support when appropriate, and we also should provide immediate feedback about behaviors and concern to appropriate staff, whether it be counselors, behavior support team if you have one, principals, supervisors, and others. So now, if a student is taken to the hospital or perhaps psychiatric care services, we have a responsibility to make sure that we have some type of re-entry procedure in place. It's important to have a procedure for students who are returning after a mental health crisis. The reason being is because we need to ensure that they have some type of plan to assure their safety when they return. So the school mental health professional and or the principal or other administrative supervisor should meet with the student, parents, or guardian, and if appropriate, meet with the student to have a discussion about re-entry and the appropriate steps to ensure that the student is ready to come back to school. The steps that you could consider include the school mental health professional or other designee will be identified to coordinate with the student, parents, or guardian, and any outside medical health care providers. You want to ensure that the school and outside providers are communicating and on the same page. Also, the parent or guardian should provide documentation from a mental health care provider that the student has undergone examination and they no longer are a danger to themselves or others. One other thing you should have is you should have a designated staff person who will periodically check in with the student and to help the student readjust to the school community and address any ongoing concerns. Now, we also have a responsibility to have procedures for what we called suicide postvention. Now, I want to emphasize 2 key points. The post-screening or post-assessment is the monitoring immediately following the threat. Postvention is what happens right after an actual suicide, meaning that the school should have some type of crisis team to develop and implement an action plan to provide guidance to the school following a death by suicide. The action plan should include the following: verify the death as well as an official cause of death prior to announcing it to the school community. Sometimes a death may have the appearances of being a suicide, and the word gets out prior to verification from the coroner, family, or police. When that happens, it can be extremely detrimental to the family and community, so it's important to verify the death. The crisis team should also assess the situation. Who does that student death impact? How severely are they impacted? Were there any other events happening at that time? Perhaps it was related to the time of year. Maybe it's the holidays or some other event. The situation must be assessed as a whole. It's also important that the team has a process for how to share information, whether it be with staff, students, or with the parents in the community. Staff must be notified first to let them know what's happened, informing staff and faculty that a death has recently happened, but the cause is unknown. And that should be done within a staff meeting. Then a written statement for staff to share with their students. For example, basic facts of the death, such as the funeral arrangements and what resources are available to help them cope with their grief. A letter to the parents should be developed with similar information, and that should be sent home. It must include the warning signs of suicidal behavior as well, so parents can monitor their own children. Also, something you must keep an eye out for is avoiding suicide contagion. The crisis team should work with teachers to identify students who are most likely to be significantly affected by that death. Also, initiate support services. Determine the level of support and coordinate services such as individual and small group counseling. The crisis team should be who looks at that. Also, I want to caution you against developing a memorial plan. There should not be a physical memorial funeral service or flag flown at half-mast on campus because it may sensationalize the death and encourage suicide contagion. The school should not be canceled for the funeral. Any school-based memorials, such as a small gathering, should include focusing on how to prevent future suicides and prevention resources available. It is also important that the crisis team has a plan for what is called external communication. The school principal or designee should be the sole media spokesperson, and staff should refer all inquiries from the media directly to that spokesperson. And that is suicide postvention. So all of that being said, I know there's a lot of heavy information that's been shared with you. But the important thing is what we want for our students. We want them to be optimistic and hopeful, to be emotionally aware, have goals, be resilient, and be empowered. That's what we want for our students, and we want to provide those supports and encourage them to develop those skills. In closing, so often it is a single caring staff person that can make a huge difference in the life of a student. Thank you for your role and continuing contribution in creating an environment at your school where each and every student can learn, grow, and belong with your support. Thank you.